child was 2.5-year-old and she told me that he haven't yet started communicating in sentences. He's only started saying one or two words, such less vocabulary that a 2.5-year-old, she told me that both of them, she and her spouse, was working. And this child was put in front of the TV for almost 4 to 5 hours. I was just thinking, a 2.5-year-old sitting in front of a screen for 4 to 5 hours. How will the communication develop? My dear parents, if you are watching this and if your child is undergoing similar situations, do take the next step to help your child. Hello all, I'm Crazy, speech language pathologist at Sravana Speech and Hearing Center. Today, I'm here in front of you because I've encountered a patient, a parent who came with me with a couple of concerns that really alarm me. So I was just thinking, are there so many other parents out there who's undergoing similar concerns and issues? Are you really facing these? And haven't you still not taken a step more to go ahead and to change things? So let me discuss with you some of the things that this parent told me. Her child was 2.5-year-old and she told me that he haven't yet started communicating in sentences. He's only started saying one or two words. Sometimes he calls her by saying Amma. Sometimes he just says yes, no. So these few words, I was just thinking, such less vocabulary that a 2.5-year-old was saying. The second thing that she came up with a concern was, the child is listening to all of the rhymes and responding by smiling when he listens to it. He is listening to the songs in his environment, to different kinds of noises, and he is turning back and looking towards it. But whenever she calls him by name, or when she calls him for a need, like probably for his meal time or for his bath time, he was just not responding. The third thing that she told me was, that was something that was really alarming. She told me that both of them, she and her spouse, was working. And this child was put in front of the TV for almost 4 to 5 hours. I was just thinking, a 2.5-year-old sitting in front of a screen for 4 to 5 hours. How will the communication develop? Do not leave it. It's an alarming concern. Sometimes your child might even develop something called as virtual autism. Sometimes your child may develop something called as learning disability. Sometimes the actual age of your child might just keep increasing, but his language age might still be really less. So when children are undergoing such issues, they might come up with a lot of behavioral changes like temper tantrums, hitting, anger. They may not even be able to stop themselves from so many things that the parents can actually think of. So as a speech language pathologist, here are some things that I really want to tell you. Here are some things that the parents can do at home to help your child even before you come to a speech language pathologist. First, start building in meaningful interaction. How will you build interaction qualitatively with your child? How will you spend your quality time with your child? Things that you can do are sit at the eye level of your child. If your child is trying to move away from you, then probably you can go down on your knees and make sure that you are at the eye level and you are trying to communicate with him. You can play your peekaboo games and I'm going to catch you and sing a lot of rhymes with him. The second thing that you can do is avoid screen time. I know practically avoiding screen time is not possible. Maybe for a lot of parents who are working, this can be the most challenging thing. But screen time is something that is pulling your child's attention to one direction. There is no two-way communication happening. Rather, pause the screen and let the parent try to speak and let the parent try to wait to listen to the response of the child as per what he sees on the screen. The third thing that you can do to build an interaction or to build the communication skills are be animated. Make sure that your child is really waiting for you to give him a delicious meal by saying, "Woohoo, I've made your favorite tea. Yummy, yummy. Let's eat something that is really delicious." Because this is something that your child is looking forward to. The child is not looking forward to a plain communication or monotonous voice. The next thing that parents can actually do is use a lot of gestures while communicating. Probably when you say, "Let's go to eat some ice cream," you can say it with action. "Let's go to eat some yum yum ice cream." And then probably if you say, "Let's go and play," you can use a little giggle and say, "Let's go and play." This will help your child to understand not just the gestures, but also what you're trying to say. Use these and see how communication develops with your child. And if you still feel that no, the child is still not responding to a lot of things, then do not wait at all. Thank you.